enjoyed the break. We're ready for our next presenter. And this is Luis Ibanez. He's from Kitware. Are you also your professor at RPI?
Correct, yes.
Yes, okay. And he's going to talk to us about open source in healthcare. Please welcome Luis.
Thank you. So we are in a very interesting time in the space of healthcare, as you may have heard if you follow the news. So I'm going to walk you through some of these interesting aspects that we're facing today. So as a planet, the entire community produces about $69 trillion. That's the global economy. This is the global GDP. Okay, so you take all the economic products on the planet, this is the number that we are producing today. The United States produces 15 trillion out of those 69. So we are about 20% of the global GDP. That's the proportion, the piece of the pie in the global economy that the US represents. Now, if you look at the piece of the pie that we invest in healthcare in the United States, out of that amount is $2.8 trillion. So about 18% of the US GDP goes to healthcare related expenditures. So about 80%, so almost 1/5 of all the economy in the United States is directed towards healthcare. This is about the same size of the federal government budget, which is about $3 trillion. So the amount of money that we invest in healthcare is the same amount of money that the federal government as a whole requires to function. And this amount is increasing. That's one of the interesting aspects. So in the past 6 months, the percentage of GDP that we invest in healthcare increased by 2%. It looks like a little number, but when you apply it to $15 trillion, that 2% is about $300 billion. That amount of money is more than what the entire software industry at the planetary scale produces. So the entire software for said industry is about $220 billion. So just the increase of expense in healthcare in the past 6 months is more than the entire software industry produces in a year. That's the kind of monster that we are facing right now. And the increase just keeps going. Now, despite all the amount of funding that is going into healthcare investment, the United States rates 18 in some of the measures of healthcare. So we are putting a lot of funding into it, but we are not necessarily getting the corresponding level of quality in delivery of care. And there are many reasons for that that we will not have to touch into. When we compare how much the US is spending in healthcare with respect to, as a proportion of GDP, we are doing 2.5 more times than the next industrialized nation. And still we are ranked 18. So it's not that we are not spending enough, it's that somehow the amount of funding that is being spent doesn't produce necessarily the delivery of high quality care that we would expect for that amount of investment. So you probably will not be surprised that for the past 3 days, if you listen to the news or read the newspapers, the Supreme Court has been debating issues of healthcare is a matter of national priorities. It's essentially whether the country as a whole will go bankrupt in the process of paying for healthcare, or we will have to do something about it. The good news, just to make you feel better in anticipation, is that the people in this room can do something about it, and it's at the reach of your capacity to change the state of affairs in the front of healthcare. So part of the complication in the US space is the way we pay for healthcare is a little bit strange, and there are historical reasons for how things evolve in this way. But essentially, the entire process of funding in healthcare is about other people's money. So somebody receives care. So we, as individuals, we get sick, we go to the doctor, we go to the emergency room. We receive care from providers, and these providers will be typically hospitals or private doctors, private practices. The providers, we don't pay the providers. The providers bill insurance, hopefully, if we are insured. So there will be somebody to be receiving those bills. When the provider sends the bills to the insurers, there is a negotiation process. So essentially, I go to the doctor, they remove my appendix. My doctor is going to say to the insurance, well, removing an appendix costs $5,000. And the insurer is going to come back and say, well, no, we really think that it should cost $3,000. So we are going to pay you only for $3,000. And they're going to bounce back and forth, and sometimes this process of iterations may take a year to be solved. So you can imagine that just in the administrative cost of taking care of that bill, a lot of extra money is spent in the time of the people on the phone, the people filling the paperwork, doing all the processing. Now, typically in the US, the insurers will get their money from my employer. So my company will pay for the largest part of my healthcare insurance. I pay a certain fraction. That goes to the insurers will pay the providers, and then hopefully I receive care if I got sick and need to go to the doctor. Now, some of the ironies is that the system in the US is set up in such a way that the providers are paid for delivering services, which may seem normal, but when you think about it, they don't get paid if you are helping. They get paid if they have to do something to you. So if we were in a situation of an evil empire and a hospital was run only for profit, it is very important for the hospital to do as many surgeries on you as they can, because that's what they get paid for. If you happen to walk into a hospital and they figure out a cheap way of making you healthy, that is actually bad business for that hospital, because they don't get paid for the healthy patients that go out of the system. So that's part of the confusion. Now, there are certain predefined items for which the hospitals or the providers get paid for, and they have to juggle between those things. So for example, if what you really need is a certain particular type of treatment, but that is what the hospital gets better reimbursed for, they may be more willing to do some other things. And that's just the reality of the healthcare industry. Now, what is interesting for this group and for this meeting is that a lot of the things that are done in healthcare are about information. So we tend to think about healthcare as medicines and drugs and surgeries, but a lot of that process is just knowing what you have, knowing what to do, having a good hint on what may work for you. So along those lines, we know that when you go to the doctor, half of the time your diagnosis is going to be wrong. Doctors will fail half of the time. So every 2 times that they look at a patient, they will fail to diagnose the correct thing. And this is not because they are negligent, this is because it is a very difficult problem. When you look at the symptoms of most diseases, you have headache and blurred vision and pain in the abdomen. So it could be hundreds of different things could be providing or resulting in those same symptoms. But this is, when you think about it, it's a problem of information. Is you walk into a healthcare facility and they don't know what you have. It's about figuring out what you have at that point and then deciding what to do. Now, because that doesn't always go as expected, in the US every year about the Institute of Medicine estimates that about 84,000 people die every year out of preventable errors that happen in the hospitals. So more people die in hospitals due to medical errors than people die in highways due to car accidents. Which have the irony that if you have a car accident, well, you go to the hospital. Well, your chances are probably lower. And some of the 2% of these medical errors are due to the fact that we are symmetric organisms. So 2% are confusion between your right leg and your left leg and operating in the wrong side of the body. If you have gone recently to hospitals that have taken measures about these things, you will notice that now surgeons and nurses go and write their sign on your arm that is supposed to receive the treatment the day before with a permanent marker to make sure that they are not going to make that basic mistake the next day. Now, every day that you stay in a hospital, you will have one medication error, statistically speaking. So you go to a hospital, and every day that you stay in the hospital, you will be the victim or the subject of one medication error. That means that you will receive the wrong medicine, or the wrong dose, or essentially the wrong patient, which is kind of the same as receiving the wrong medicine. You may get lucky and may survive that particular event, or that event may have consequences. That means that next year you're going to come back to the hospital for something that actually was caused by your first visit. Again, that all these kind of secondary effects add to the cost of the care. You go from one thing one day, and then you have to come back 6 months later for something that is probably more That results in 7,000 deaths a year on US hospitals due to medication errors. But again, when you think about it, it's just a pure information problem. It's somebody failing to check your identity against the prescription of the doctor for the right dose, for the right medicine.